You're taking your thyroid pill every single morning. Your labs are normal, but you still feel exhausted, foggy, and just off. What if I told you the medication isn't the problem? The problem is what you're doing in the 30 minutes after you take it. I'm Dr. Mina, and as a pharmacist, I see it every day, patients who do everything right, yet they're still running on empty. Today, I'm showing you the silent killers that are literally washing your medication down the drain. If you've ever felt like your doctor isn't hearing you because your numbers are fine, this video is going to change your life. Before we get to the killers, you need to understand why levothyroxine is so picky. Your stomach is like a chemistry lab. This pill is a base that requires a very high level of gastric acid to break its outer shell. When you wake up, your stomach is at its most acidic. That's the perfect dissolve zone. But the second you put anything else in there, even a piece of toast or a splash of milk, your stomach's pH level rises. It becomes more neutral. When that happens, the pill doesn't dissolve, it just sits there like a pebble. By the time it reaches your small intestine where absorption happens, it's still a solid rock. You aren't just absorbing less, you might not be absorbing any of it. Now, the big one, the morning coffee. I know, you feel like you need it to wake up. But coffee is a double whammy of sabotage. First, it's a stimulant that increases gastric motility, meaning it pushes the pill through your system before it can finish dissolving. Second, research shows that coffee contains sequestering agents. Think of these like tiny magnets that grab onto the levothyroxine molecule and won't let go. Once they're stuck together, the molecule is too big to enter your bloodstream. Drop a coffee cup in the comments if you've been taking your pill with coffee. It's okay, we're fixing it today. This section surprises people. Did you know walnuts can actually block thyroid absorption? Or that high-fiber cereal acts like a sponge, soaking up your medication and carrying it right out of your body. And then there's soy. Soy can inhibit the actual enzymes your body needs to process the hormone once it's in your blood. If you love soy milk or a high-fiber breakfast, you need to push that meal back at least 90 minutes. We want a clear runway for that pill to take off. This is what I call supplement sabotage. You feel tired, so you take iron. You're worried about bones, so you take calcium. But these minerals are heavy hitters. They bind to your thyroid med to create a molecular clump that is physically too large to pass through your gut wall. Crucial warning. If you take antacids, like Tums or omeprazole, for heartburn, you are neutralizing the very acid the pill needs to dissolve. The 4-hour rule is your best friend here. Pill at 7 a.m. No vitamins or antacids until 11 a.m. Period. But sometimes, the killer isn't what you eat, it's what's happening inside your body or other medications you're taking. Other binders, meds like bile acid sequestrants for cholesterol, orlistat for weight loss, or sucralfate for ulcers are absorption killers. Think of these like chemical handcuffs. They grab the levothyroxine and physically prevent it from ever reaching your bloodstream. Then there are GI conditions. Celiac disease, lactose intolerance, and inflammatory bowel disease, IBD, physically damage the absorption floor of your gut. Even a hidden infection like H. pylori or chronic gastritis can change your stomach's pH forever, making the pill sit there like that pebble we talked about. If your TSH levels are still swinging wildly, it's time to talk to your doctor about a gastrointestinal screening. You can't fix your thyroid if your gut is broken. Let's talk real life. Dr. Mina, I woke up late, ate breakfast, and then remembered my pill. What do I do? Option A. Wait 3 hours. Your stomach needs that long to empty. Take the pill, then wait another 30 minutes to eat again. Option B. Use the bedtime strategy. If your morning is ruined, take it at night. But there's a catch, you must have an empty stomach, which means no food for 3 to 4 hours before bed. Studies show nighttime dosing can actually lead to better absorption because your gut slows down while you sleep, giving the pill more quality time to dissolve. One last tip you won't hear often: alcohol. If you had a couple of drinks the night before, your liver is busy processing that toxins the next morning. Since your liver is also where your T4, inactive hormone, gets converted into T3, active energy, a hangover morning can make your medication feel less effective. Hydrate well, and give your liver a break if you want your thyroid meds to actually work. To recap, give your pill 30 minutes of alone time with a full glass of plain water. Wait 60 minutes for that coffee or breakfast, and keep your supplements 4 hours away. Remember, small changes in timing are often more powerful than increasing your dose. If your energy hasn't returned despite normal labs, try this clear runway approach for 2 weeks. Your health isn't just about the pills you take, it's about making sure those pills actually work for you. I'm Dr. Mina. If this helped you take control of your health today, hit that subscribe button for more med talk. Share this with one person who is always tired but wired. I'll see you in the next deep dive.